it's one shot. Good morning. Welcome again to day 2 of the joint appropriations hearings for the 2021 session. Thank you again for joining us, those of you who've joined us in person, and then those of you who've joined us virtually. Thank you for your participation yesterday as we went through this virtual mix for the first time. Overall, it got, sorry, my mask is getting in my way this morning. Overall, it got pretty good reviews across the board. Again, thanks to House Media Services, our folks on the Senate side who helped as well to keep everything moving. Tried to keep you on time, and thank you for the feedback from members. At the end of tomorrow's session, we may ask you for additional feedback as to whether or not you think this will be something we'd like to look at moving forward and ways we can improve it as well. Thank you again for joining us. We'll hand it over to Chairman England for a few comments to get started.
Well, good morning. Hope everybody's doing good. Thank you again for being with us today. We've got a pretty packed day today, so just bear with us as we get through all the presentations. Just a couple of housekeeping items. Again, if you are a member of the House or Senate Appropriations Committee, do follow the Zoom link to get onto the meeting. I would ask that all other House and Senate members that are not members of the Appropriations Committees, if you would use the live stream so that we're remaining mindful of the bandwidth capabilities coming and going, but also if you have questions, do type those into the chat box on Zoom. And again, just a reminder, that's for members of the committees only. If you're not a member and you do have a question, if you would kindly ask a member of the committee to send that question in on your behalf. It just helps us kind of streamline things and keep everything moving. So it's the only little housekeeping thing I've got there. Mr. Chairman, I'm looking forward to another full day, but I think it's going to be a good day. And again, our thank you to our House Media Services folks and our friends in the Senate that have worked on putting the schedule together, Melody, Martha, and everybody that have made the first day so far successful, and think that today will be as well.
Thank you, Chairman England. Just to give you a little run of the show for the day, those of you who do not have your agenda, we'll hear first from Commissioner Ward. We'll move then to Commissioner Oliver from the Department of Juvenile Justice. We'll hear from Colonel Wright at the Department of Public Safety around 9:30. Chief Justice Melton will join us at 10. We'll have a presentation from the Superior Courts at 10:30. We will break for lunch at 11 and come back to hear from Commissioner McMurray at DOT at 1. Commissioner Wilson from the Department of Economic Development at 2. Commissioner Williams from Department of Natural Resources at 2:30. Commissioner Dozier from TCSG at 3. And then we will end the day hearing from the Director of Financing and Investment, Ms. Diana Pope from the Georgia State Finance and Investment Commission. We should end up again, hopefully right on time at 4 o'clock. That being said, it's 8:05, and do we have Commissioner Ward with us already? We're online? Commissioner Ward, we think you're online with us. Can you hear us? Let's see. Commissioner Ward, if you can hear us, we can't hear you. Give us just a second to run through and check our technical issues up here. Commissioner Ward, we're going to check one more time. Can you hear us? Okay, I think we got you there now. Commissioner Ward, can you hear us this time? They can hear him online? Right, I think they're hearing him online, but we're not hearing him in the building. All right, Commissioner Ward, let's try one more time. Can you hear us now? From what I understand, they can hear you online. We just cannot hear you in the room. That's about where we're going. Commissioner Ward, we're coming to you one more time. Can y'all try speaking on your end? No, still can't.
I can hear you clearly.
All righty, there we go. Thanks again to our friends at House Media Services
All right.
for getting that worked
All right.
out.
First of all, okay. All right. First of all, thank you for allowing me to speak before you, Mr. Chairman, today. The mission of the Georgia Department of Corrections is to protect the public by operating safe and secure facilities through the development of professional staff and effective offender management. Since my presentation last January, this mission has been tested, and I'm proud to say that our team rose to the challenge during the COVID-19 pandemic. Next slide, please. I would like to start by providing an overview of key metrics for the Department of Corrections. There are a total of 92 facilities across the state, including state facilities, county camps, and private prisons. Of the 35 state prisons, 7 are close security, 14 are special mission, and 14 are medium security. Additionally, there are 7 detention centers, 12 transition centers, 11 residential substance abuse treatment facilities, and 2 integrated treatment facilities. Next slide, please. The current total population right now is 47,311. 73% of our offenders were convicted of a violent crime or a sex offense. 14,103 have a validated gang affiliation. Current average length of sentence is 12 years. 62.98% of the offender population are serving sentences of 15 plus years. 7,640 offenders are serving a life sentence, with 1,644 serving life without parole. We began the fiscal year with approximately 10,860 offenders with a diagnosed mental health classification. On average, we have 13,000 plus offenders with a chronic illness, and that chronic illness can range from cardiovascular disease, diabetes, respiratory, COPD, cancer, and HIV. The department dispenses an average of 101,000 prescriptions per month to treat these and other illnesses, including mental health and general medications. Next slide, please. Now, I would like to discuss the department's operational response to the COVID-19 pandemic. Next slide, please. At the start of 2020, the inmate population had began to increase from a low in 2014. This was due to inmates that have been convicted of violent crimes or sex offenses, resulting in longer sentences and length of stay. However, due to the suspension of court activity, the department has seen a 16% reduction in the population. Once courts resume to normal operation, we expect the population to increase to the previous levels. Next slide, please. Now, I would like to review some of the actions the department initiated to contain and manage the virus during the pandemic. Following the CDC and Health Department guidelines, the department addressed the situation through communication and coordination, prevention practices, operational actions, supplies, and PPE, and enhanced cleaning and disinfecting. Communication and coordination. We immediately created a COVID-19 response team and updated our influenza and emergency response plans based on CDC and Health Department guidance. Then we immediately began communicating the information throughout the entire system. We implemented bi-weekly meetings with all wardens and superintendents from all facilities throughout the state. This also included bi-weekly meetings with our health services team and Georgia Correctional Healthcare to quickly respond as new information became available. We created a GDC Connect app, mobile app, to communicate updates to all our staff members. On March the 30th, 2020, the department implemented a dashboard on our website to consistently report staff and offender cases within the system. We developed an employee peer support team to assist individuals who had been infected by the virus, and an offender staff communication committee to provide information to offenders throughout the state. Next, I would like to discuss some of the prevention practices that we implemented. Based on the governor's emergency order, diagnostic intake was suspended on March 14, 2020. Offender movement within the system was also suspended except for medical or security purposes. The department resumed diagnostic intake on May 18, 2020, with enhanced COVID-19 procedures to ensure that offenders were provided masks and were tested and quarantined while awaiting test results. Additionally, prior to release, offenders were provided written instructions on COVID-19 precautions. This information is now being updated to include formation of a vaccine or the vaccine procedures. Health screenings and temperature checks were implemented for all staff that entered a facility state system-wide. In-person classroom instructions were altered by reducing class size, providing self-study materials, and identifying and training GDC staff to conduct GED testing. We suspended all contract details once the pandemic hit to minimize the spread of the virus into a facility. Additionally, we implemented telework schedules for all non-essential staff. Next slide, please. The department immediately began to source PPE and disinfectants to meet the challenge. The department partnered with the Georgia National Guard early in the pandemic to train GDC staff on the proper use of the fogging equipment to sanitize facilities. Once the staff were trained, we implemented mandatory weekly fogging of dorms, administrative areas, including infirmaries and clinics and entryways. Additionally, fogging was conducted when positive cases were discovered. The department refocused the efforts of Georgia Correctional Industries to produce cough, sneeze masks, gowns, and disinfectants. All staff and offenders were required to wear the cough, sneeze mask. Georgia Correctional Industries has produced and we have distributed over 500,000 masks to the offender population during this pandemic. Due to the high demand for disposable gowns throughout the country, Georgia Correctional Industries began sewing reusable gowns that could be washed up to 100 times and reused again. The department implements health screenings, including temperature checks at all staff and at the front entrances of all facilities. These have been replaced by temporal scanners to enhance the ability to social distance during the health screening process. The department implemented enhanced cleaning and disinfection at all entry points and high traffic areas within the facilities. Hand sanitizer was purchased in bulk and distributed throughout the system. The department waived medical copay for offenders with symptoms of COVID-19 or for clinical care for flu-like symptoms. Based on the governor's emergency order on March 14, 2020, visitation was suspended at all facilities for all offenders. In order to maintain communication with the family members, the department immediately provided 1 free phone call per week and 2 free JPay stamp emails for all offenders to continue the communication with their families. To further address offender morale while visitation was on hold, the department began providing additional incentive meals and grab bags each month to the offender population. To maintain operation with safety precautions, including social distancing, we increased our use of telecourt, telemedicine, and telepsychiatry during this pandemic. Next slide, please. On March 16, 2020, Post directed statewide closure of all law enforcement academies, and we immediately redirected staff to assist in the distribution of PPE and to assist in fogging of 62 state facilities within the first 19 days of the pandemic. The training staff also assisted with the initial distribution of PPE from the state emergency stockpile. GDC was allowed to reopen BCOT, Basic Correctional Officer Training classes, regionally under Post guidance on May 4th, 2020. Since training was reinstated, we have graduated 743 officers from basic training and currently have 100 cadets scheduled to graduate Thursday, January 21st, 2021. Specialized training programs throughout the state were reinstated on July 7th, 2020, following strict sanitation procedures and guidelines by the CDC. Next slide, please. I mentioned earlier that we created a COVID-19 reporting dashboard on our website. This was initially launched on March 30th, 2020. I encourage you to visit our website and you will see the links to the COVID-19 dashboard on our main webpage if you go there, okay? Next slide. This next slide shows the actual dashboard, which is updated daily at 6 p.m. My presentation was presented to you all on Friday, so the figures that you're seeing right now are the figures from this past Friday, but our totals this morning, as of this morning, the staff confirmed cases are 1,473, staff recovered cases are 1,288, and unfortunately, we've had 2 staff deaths during this pandemic. Offender confirmed cases during the pandemic, we've had 3,056 confirmed cases. We have 2,619 that have recovered, and we've unfortunately had 88 deaths during this pandemic. Next slide, please. Now I would like to provide an update on the COVID expenditures for the department. Since the beginning of the pandemic, we spent a total of $2,994,763 on PPE. This does not include the PPE that we received from the emergency stockpile. Additionally, we spent a total of $3,957,848 on sanitation and chemicals, $756,459 on equipment, foggers, temporal scanners, and thermometers. We spent $7,463,158 on healthcare, $4,553,210 on jail subsidy, and another $1,745,237 for additional meals and water. This brings an agency total expenditure for March through December of a little bit over $21 million that we spent to fight the pandemic within the prison system. Next slide, please. Now, I would like to ask Randy Sauls, our Assistant Commissioner for Health Services, to provide additional information concerning the department's operational action from a medical perspective as we dealt with COVID-19 in the prison system. Mr. Sauls.
Thank you, Mr. Commissioner and members of the joint session. The administration of the annual flu vaccine has long been an important component of GDC's control plan. This
Next
year,
slide, please. Next slide, please.
thank you. We'll start with our flu vaccination surveillance. Again, the administration and the annual flu vaccine has long been an important component of GDC's infection control plan. This year, due to the pandemic spread of COVID-19, it has been recommended that taking the flu vaccine is an important step toward mitigating a twin-demic. That is, the presence of both the flu and COVID-19 at pandemic levels. Each year, GDC encourages its employees to take the flu vaccine. Employees receive educational notices reminding them that they may readily obtain the flu vaccine from their medical provider, local pharmacy, or public health department at no cost to them, as it is provided as a covered benefit in their state health insurance plan. Additionally, the Georgia Department of Corrections Human Resources Department partnered with the Department of Public Health and local county health departments to offer and sponsor flu vaccination fairs at GDC facilities around the state. This was met with enthusiasm and support by GDC staff. Offender education. Each year, offenders are offered the flu vaccine with a special emphasis on those with chronic medical conditions. This year, there was an increased effort to promote the flu vaccine among offenders and encourage vaccine participation. As an incentive, a grab bag was provided for those offenders who took the vaccine. Weekly flu vaccination surveillance is also performed, and offenders are monitored daily for any sign or symptoms of flu. So far this year, we've offered 14,557 flu vaccinations and have administered over 10,232. Vaccinations will continue to be offered weekly as flu vaccine does continue through April. And I might also add that this is a significant increase in the number of vaccinations offered this year than over previous years. Next slide, please. I'll now turn your attention to COVID-19. The graphic presented on the screen displays the number of positive COVID-19 cases reported daily. The daily additions are displayed in blue on the blue line, while the 7-day moving average for COVID-19 is represented on the red line. GDC began tracking this data starting with its first reported case in February of 2020. The peaks associated on the blue line on the run chart indicate when batch test results were reported. Early during the pandemic, test results were slow to be reported and reports were batched. Most recently, the blue peaks on the run chart reflect daily test results related to GDC's return to accepting new intakes and adopting a change to the CDC guidelines that requires a COVID-19 test during day 10 of any quarantine period. Now, the 7-day moving average on the red line reflected on January the 14th, reported on the graphic, shows 25.7 cases for the previous 7 days. The graphic mirrors similar published charts displaying community spread and includes test results for all facilities that house state offenders across the state. Next slide, please. This graphic displays COVID-19 related hospitalizations, again beginning with the first admission recorded in February. Now, approximately 90% of offenders who contract COVID-19 recover from their illness without any medical intervention. Others may, however, require an episode of hospitalization. The number of acute COVID-19 related hospitalizations peaked in August at 69. There has been an observable decrease in the number of hospitalizations for the months since that period. There were 333 total hospitalizations during the months of February through December, and these hospitalizations represent about 14% of the 2,348 total hospitalizations during the same period. Next slide, please. GDC follows all CDC and Georgia Department of Public Health guidelines related to the mitigation and control spread for COVID-19. In several instances, GDC has adopted procedures that exceed the published guidelines and takes additional precautionary measures to enhance the mitigation and spread of COVID-19. We're reminded that these are ever evolving and changing guidelines and have been throughout the pandemic. Observance of these guidelines is monitored closely. Updates and newly published guidelines are reviewed and interpreted by the GD State Medical Director, who then issues agency-specific interpretive guidance, protocols, and procedures. These guidelines are then published and shared agency-wide by the Director of Facilities to all GDC wardens, superintendents, private facility wardens, county wardens, and leadership command staff. Now to the slide at hand. Close contact tracing, quarantine, and COVID testing are an integral disease surveillance activity that is performed daily on the offender population. The monitoring of sick call, requests for medical care, and the observation for the display of COVID-19 related symptoms triggers a rapid response that leads to medical isolation, quarantine, and testing of the offender population. Now to the left side of the graph, COVID-19 symptomatic offenders are immediately removed from the population and placed in medical isolation. These offenders are immediately tested for COVID-19 and will remain isolated for 10 days, even in the event of a negative test. For those who are asymptomatic and are exposed to the circle of exposure, they are immediately placed in quarantine, and as they're identified as close contact. And on day 10 of the quarantine period, the COVID-19 test is performed. Individuals who test negative and remain asymptomatic are required to complete the 14-day period. If an individual tests positive, they will be placed in medical isolation for 10 days until they are symptom-free, or they may be extended days depending on the severity of their acute symptoms. Next slide, please. Thanks to the governor's effort, GDC has the availability of the Abbott Binax Now Rapid COVID-19 Antigen Test. It's highly reliable for those who test positive. For those who test negative, the test is less reliable and must be followed up with a PCR test to confirm the previous rapid negative result. Those individuals will be medically isolated for 10 days until the confirmatory test result is reported. As a result, GDC has limited the use of the rapid test to 2 occasions. For symptomatic offenders, those offenders who present with symptoms, they're tested and have tested positive, will be immediately isolated for 10 days with no follow-up PCR required. This avoids the cost and time associated with a second PCR test. The second way the test is used is for asymptomatic offenders who are scheduled for an elective transfer for an elective procedure at a hospital. Many hospitals require a rapid test upon arrival, and by testing these offenders before they leave for the hospital, it avoids an unnecessary return trip in the event COVID-19 positive test results are returned. GDC provides rapid testing of those going to the hospital and avoids additional unnecessary costs to the hospital in the event of a positive test. Next slide, please. Let's discuss our COVID-19 vaccination implementation plan. GDC prepared and submitted the COVID-19 vaccination plan for the offender population on October the 20th of 2020, following the publishing of the CDC and DBH guidelines. According to phase 1, offenders aged 65 and older are eligible for the vaccine. There are currently 1,421 offenders over the age of 65. 1,375 of those offenders are male, and 46 of the offenders over the age of 65 are female. These offenders were surveyed last week on their likelihood to take the vaccine. 49% of said that they would take the vaccine, or approximately 698. We do expect upon arrival of the vaccine, we'll begin immediate vaccination of those offenders over the age of 65 that are in phase 1. Also be reminded, we've modified our release protocol for offenders released for custody to include general COVID-19 instructions, to discuss symptoms, medical isolation, to include notification of family and public health notification of the counties in which they will be released. Vaccine information is also provided, including what to do in the event they are released before they receive the second dose of the COVID-19 vaccination. Commissioner, I return my slides back over to you at this time.
Okay, all right. Next slide, please. I'm gonna jump over real quickly, and I got a request to move through my slides really quickly. The next slide is just showing you an education update of some of the highlights that we've done throughout the system, showing the things that we're doing. I want to just highlight on this slide about the reentry support documents. That's very important. The driver's license that's being issued during this time, we issued 29,335 driver's license, birth certificate 49,190, and social security cards 35,386. Okay, next slide, please. The next slide is our evidence-based prisons. We talked about that on last year. One of the big things I want to highlight in the evidence-based prison is our gang renunciation program that's involved at these three facilities: Lee State Prison, Hancock, and the Metro Reentry Facility. That gang renunciation program has really driven down the total numbers of disciplinary reports and things of that nature. Okay, next slide, please. And also, if you look at the bottom of that, if you go back, if you look at the bottom of that slide, there's a video that you can later on look at about the evidence-based prison in that program. Okay. Next is our physical health transition. As discussed during last year's presentation, our healthcare expenditures have been rising significantly over the past 5 years. GDC has been in partnership with Georgia Correctional Healthcare for over 23 years. During this time, physical healthcare practices have changed significantly while our processes has not caught up. We brought in an external consultant to analyze our system and make recommendations on how to improve service delivery and developing a sustainable cost model. It was determined that we should bid out our physical healthcare services in order to obtain a more modern approach. Pharmacy services were bid out last summer, and we're in the process of finalizing that contract award. Physical health services, this request for proposal for health services was released on yesterday, 1/19/21. This request is for a vendor to manage the ASMP hospital and infirmaries and clinics across the state. Additionally, the successful vendor will manage the network of hospitals and outside clinical providers across the state. Based on our current schedule, our goal is to complete a transition to a new vendor by September 2021. Next slide, please. Mental health services expansion. 20% of the GDC offenders are being treated for a diagnosed mental health condition. The goal is of this expansion is to provide mental health service to all close security facilities. Additional benefits include reduced offender transportation, movement, improved response to mental health crisis by having staff on site, and improve access to mental health by having all programs and services on site. Additionally, our mandatory 24-hour mental health training program for 100% of all facility staff to assist those providing and supporting our mental health mission. Next slide, please. Again, you'll see the breakout of that. We're going to add additional, we've added almost 550 additional mental health beds to the system in the last 2 years. Next slide, please. Virtual court hearings. Originally, the department had a goal of implementing the virtual court systems in 50% of the judicial circuits by July of 2020. Next slide, please. I apologize. Okay. Due to the suspension of in-person court proceedings on March 14, 2020, we were able to increase the rollout of telecourt to 43 or 49 judicial circuits by last summer. The response, that represents 88% of the total jurisdictions. We are now averaging over 400 hearings a month and exceeded 450 in December. At this pace, we should exceed 5,000 hearings in 2021. Motions, arraignments, habeas pleas, sentencings are the fastest growing types of hearings and have allowed the court system to keep moving during this pandemic. The virtual court process has significantly reduced travel time, resulting in less overtime expenditures and expenses and fuel costs. Next slide, please. Leveraging technology. The department is working with a vendor to implement a new inmate assignment decision support system. The state-of-the-art advanced analytics behind IADDS enables a correctional agency to consider a multitude of factors affecting the assignment of inmates and scheduling their treatment program. There's a large number of factors to consider when placing offenders, and technology can assist in analyzing these factors, reducing potential for human error and improving the efficiency of the process. Contraband interdiction is an ongoing concern of the department, and we continue to evaluate technologies that will assist us in defending our perimeter and reducing the possibility of contraband being introduced to the facilities. Next slide, please. Next, I would like to thank the governor and members of the House and Senate for their support of an $18 million increase in our bond funding last year. This is critical and important for maintaining our infrastructure, and we are thankful for the governor continued support at this time, levying with the level of funding for the fiscal year 22. The average age of our state prison is 39 years. 3 of the facilities are over 70 years old. The average age of our PDCs, TCs, and RSAT centers is 31 years in age. Based on the age of these facilities, the additional bond funding is supporting the replacement of roofs, mechanical systems, water and wastewater systems, and security system upgrade. Next slide, please. Next, I would like to review the FY21 budget recommendation as beginning on page 8, House Bill 80 tracking document. Probation Detention Centers, page 8, item 19.3, transfer a total of $1,505,131 from state prisons and offender management programs to cover the cost of the new residential substance abuse contract. The second item is language concerning the opening of a new 50-bed dorm at Bacon PDC. This language is to move offenders and staff from other locations to support the operating expense of this dorm. Health Services, page 8, item 19.5, transfer $3,872,236 from state prison to the health program to cover projected healthcare expenditures for fiscal year 21. Offender Management, page 8, item 19.6, transfer $861,994 to Probation Detention Centers to support RSAT contract. State Prison Program, page 8, item 19.8, transfer $4,515,373 to the Probation Detention Centers and Health Program to support the new RSAT contract and healthcare expenses. One-time funding for replacement vehicles of $3,320,000. The fourth item is language concerning the opening of 4 new dorms at Metro Reentry Facility. This will house over 400 additional TC beds. This language is to move offenders and staff from other locations to support the operating expense of these dorms. Transition Centers, page 8, item 19.9. This item is language concerning the opening of a new 100-bed dorm at Smith Transitional Center. This language is to move offenders and staff from other locations to support the operating expenses of this dorm. Next slide, please. The third item for the governor's recommendation is to utilize existing funding to support a 10% increase for correction officers beginning April 1st, 2021. Page 8, item 19.8.3. This increase will move the starting salary for a correction officer 1 working at a medium security facility from $27,936 to $30,730, as well as a correction officer 2 also working at a medium security facility from $31,040 to $34,144. Additionally, it will move the starting salary for a correction officer working at a close security or special mission facility from $31,040 to $34,144, and a correction officer 2 also working at a close security or special mission facility from $34,144 to $37,558. All security positions listed will receive an increase. This is also included in the FY22 budget, and that's going to be a real big shot in the arm for the Georgia Department of Correction, for those well-deserving men and women who've been on the front line during this pandemic fighting this invisible enemy. Next slide, please. Next slide, please. Next, I would like to discuss the FY 22 Governor's recommendation. Beginning on page 24, House Bill 88 tracking document, statewide changes, increased funds to reflect an adjustment in employee share of the teacher retirement system from 19.6% to 19.81%. Probation detention centers, page 24, item 19.3, transfer $3,016,262 from state prison program to cover the annualized cost of the new RSAC contract. Item number 2 is related to the new dorm at Bacon PDC as discussed in the amended budget. State prison, page 24, item 19.8. The first item is related to the new dorm at Metro Entry as discussed in the amended budget. The second item is to transfer $3,016,262 to the PDC program to cover the annualized cost of the RSAC contract. The third item is to fund the cost of the correction officer salary increase. Transition centers, page 25, item 19.9. This item is related to the new dorm at Smith TC as discussed in the amended budget. Next slide, please.
Oh, go back.
Go back.
Go back one.
Go back one more. You missed one. Go back. Next, I would like to discuss our bond funding for FY 22. This year, our bonds were consolidated into 3 major categories. The first is $15 million for emergency repairs. The second bond is for $15.6 million for security improvements. And the third bond is for major repairs and renovations is $14.9 million. There's not a bond for vehicle replacement as this was funded in the amended budget And that concludes my presentation. We were a little long-winded a little bit, but we had a lot going on in the last 10 months. I want to make sure that we were as transparent as possible, letting you know everything that we've been doing during this pandemic. And without further ado, sir, I'm open to questions. Thank you.
Thank you, Commissioner. Thank you for your presentation, and sorry for the few minutes we took from you at the beginning. We'll add them to the end if there are questions that need to go into that time frame. First question comes from the audience here present with us, and it'll be our Chairman of Public Safety on the Senate side, Chairman Albers.
Thank you, Mr. Chairman. Commissioner, thank you for your leadership and the great work that you and your team continue to do. I was very happy to see the increase in salaries for our correctional officers. I know that we've experienced extraordinary turnover, which is very difficult from a management and a finance perspective. Based on these increases that are proposed, do you believe that that will put us on par with the states around us, or is there more work left to be done there?
I think it's a good direction. Put us on par with states around us. This is a big, like I said, this is a big shot in the arm. These are living wages that people can come to work and earn a decent living right now.
Thank you.
Next question from the audience, Senator Beach.
Yeah, thank you, Mr. Chairman. Commissioner, y'all touched a little bit on pharmacy cost, and I believe you went over it pretty quickly, but did you say you've been with the same company for 24 years? And my question to you is, are we looking at generic drugs to cut cost? I mean, you know, I know my drug costs have went up every year on an annual basis. Are we really focusing on how we can cut pharmacy cost?
Yes, we have volume pricing for generic drugs. We've been utilizing that 340B plan, and like I said, that procurement is on the street still in competitive. Well, I think we're in the protest period right now.
Thank you.
That's all the questions we have in the audience. I think we may have a few online. Chairman England.
Don't have any questions online, just a couple of comments, but just to our folks watching, the presentations are listed on the General Assembly website, House Budget and Research Office tab. Go under the Joint Budget Hearings tab there, and the presentations will be there that you can print off if you need to have them printed off or saved to your device. Do have one question from Representative Timothy Barr. Are you utilizing electronic monitoring at all?
In what capacity? I can't follow the question.
Well, he doesn't state. I guess overall in the total population.
One of the things on my slide, as far as leveraging technology, we're still a pen and paper type system. We're trying to leverage as much technology we can as far as electronic logbook, electronic record keeping. So as a retention tool for the younger generation, because a lot of instances, a lot of the employees that we hire, they're not used to this pen and paper deal that we have right now. So we're aggressively trying to push electronics to do the things that we need to do.
Okay, that's all the questions I've got from online. I know we've got one more in the room, but I did want to say something here, not only to y'all and your guys at Department of Corrections, but at Juvenile Justice, Public Safety, and the Georgia National Guard. I know we've got quite a presence here in Atlanta today, protecting the people's capital, and we just want to all say how much we appreciate. And I know that your guys have been here on multiple occasions, just as the others have as well. But just want to tell you how much we appreciate that, not only from ourselves, but for our staff members and just for the safety of Georgians in general. We appreciate the presence here today and that have been here all summer and fall as well. So thank y'all for that.
Okay, thank you. And I think I see a question about you were talking about ankle monitors, I think. And we do utilize it on our firefighters at one of our firefighting teams in South Georgia.
Commissioner, we have one more question in the room from the whip, Vice Chairman Gooch.
Good morning, Commissioner. I'm Steve Gooch from Dahlonega. I represent Union County, where you have Caldwell Detention Center. Could you briefly discuss what your plans are this year for that facility? A lot of the communities up there, the counties and cities, utilize your inmate details for a lot of services, and they're not able to get those at this time due to the COVID-19.
Well, we again, that is a well-kept secret up in North Georgia. Diane Hassett, who's the superintendent, does an awesome job up there. They have probably one of the leading rescue dog programs in the state. They've been featured nationally. So we're steady pushing. That's one of the things that we do, the labor details at our probation and detention center, and we're continuing trying to make sure, but we do this pandemic, getting these guys in a safe manner and make sure we screen them and get them out to work. But Caldwell PDC is the top of my plans. It's not going anywhere. It's going to stay right where it's at. If I answer the question.
Commissioner, I think that is all the questions that we had from the committee members. Thank you again to you and your team for being here and presenting the report you presented to us. We look forward to following up with you more in detail in subcommittee meetings that will begin really shortly. Thank you again for being here today.
Okay, thank you.
Next, a little bit ahead of time, but I believe our Department of Juvenile Justice team's already here, and Commissioner Oliver, we'd like to invite you on up if you'd like to. Yes, sir. Come on.
Good morning, and thank you again, Mr. Chairman and members of the committee for being here. It's an honor to be here before you again this year to talk about our agency and our budget. So I'll just jump right on into it. As many of you all know, that we operate 25 secure facilities around the state and approximately 90 community offices around the state. We also have our own school district, or the 181st school district in the state of Georgia, and I'm proud to say that even during the pandemic, we continued schooling for our youth in our care, and they've done a phenomenal job in making sure that they continue their education on that point. Just kind of give you guys a brief overview of our COVID-19 impact and our numbers that we have cumulatively since the pandemic. We've had a total of 413 staff who have tested positive, 321 have since recovered, and 121 youth have tested positive since the pandemic, and 108 have recovered. Currently, we have 13 positive cases. And just like Commissioner Ward and DOC, we've leveraged the Binex Now rapid test, and we've administered 1,282 of those tests, and we have a 5% positivity rate. 62 of those out of those 1,282 have tested positive. And we also administering those tests for our youth and our staff who are symptomatic to ensure that they don't spread the COVID-19 into our facilities. With that being said, let's go ahead and jump right on into our amended FY 2021 budget and allow time for some questions if the members of this body have any. The first item on the amended budget is to utilize existing funds to implement a 10% increase for our juvenile correctional officers. As Commissioner Ward stated earlier, it's a huge shot in the arm for our JCOs within our secure detention, and how that will look. We will leverage $2,550,000, and that's going to be the total impact. $738 is going to be on the YDC side, and our YDC is $1,500,000, and admin is $2,799. And how we're going to do is we're going to free some vacant positions, and so it's going to be a total of 297 frozen positions to get to that number, 110 on the YDC side, and 187 on the RYDC side. So after we freeze those, we have a total vacancy count in security positions of 420 statewide. And let me just pause right there for a minute, because I think it's going to be pretty much the same in the big budget, but just kind of give you guys a little bit of background. Also, earlier this year, we did an employee engagement survey amongst our staff, and about 2/3 of our employees taking that survey to just trying to gauge the climate of where we're at as an agency and why people are staying, why people are leaving. We also do exit interviews as well. But in that employee engagement survey, number one on the list for our employees, which was most important to them, was pay, compensation, and benefits. Secondly, was stress in the workplace due to pay, compensation, and benefits, and everything else below that was just as far as culture, dealing with a difficult population, and then also management. And so we've made great strides on the management piece. We're making sure that we're sending all of our leaders and supervisors to extensive management training, more management training, putting emphasis on that. So just to have this 10% increase inside the budget at a net zero, that we can free some positions, is definitely a shot in the arm, and it speaks volumes to our employees to let them know that we're actually listening to them, and we know how much this means to them as well. Moving on to the FY 2022 budget, item number one is a statewide increase, it's a increase for teachers' training and experience. According to the Georgia law, teachers get paid based off their training experience and certifications. In years past, this hasn't been funded in our current budget, and so oftentimes when teachers gain those certifications and that experience, they're asking for those certifications. If they go to a traditional public school, they would get those, and so we're asking for that to be placed in the budget in the governor's recommendations for a tune of $227,110. Next item is a statewide increase for teachers' retirement system of 19.6% to the tune of $78,000. And then again, item number 3 is to utilize existing funds for a 10% increase for our juvenile correctional officers. And again, we're still leveraging that by freezing some vacant positions. And that will conclude the our budget presentation. Oh, no, I'm sorry, let me go to the bond package. Apologize. And a bond package is recommended for $35,510,000 to be put into our bond package. The biggest things in there really is the construction of a 56-bed housing unit in Muskogee YDC. Muskogee YDC was built in 2005, I believe, and it's cottage style housing, and we're spending significant money each year on keeping and upkeeping that. So putting a 56-bed unit on that campus will allow our staff to have all the youth under one roof and not having separate dorms. Same thing goes for the Augusta campus, YDC campus. Is a construction of a 56-bed facility there, as well as the design for the educational building, which is in pretty bad shape. I want to say Augusta YDC was built in 1964, so as you can imagine, we're spending a significant amount of money for upkeep in that. Next significant item on the bond package list is utilizing our contraband detection system. We're trying to go and do a pilot program for placing about 9 body scanners within our secure facilities and utilizing technology that will help deter and detect any kind of contraband or weapons within coming into our secure facilities, which is going to be a huge benefit on many levels. As you all know, most of our staff are female staff, most of our offenders and youth in our care are male, and so when it comes to adequately and effectively searching the youth that come into our care, we can do it a little bit more effectively by utilizing this technology around the state, and also reducing some trauma. As you can all imagine, some of the youth that come to us, if not most, have some type of trauma and triggering actually being strip searched. We can eliminate most of the strip searches unless something is actually detected in that body scanning technology. So we're really excited about the potential of that proposal. And with that, Mr. Chairman, that concludes my presentation. And I open to up for any questions.
Thank you so much, Commissioner Oliver. Appreciate you being here. We have a couple of questions. First would be from Representative Perkle.
Thank you, Mr. Chairman, and thank you for your service to our state in this important endeavor. In your testimony last year, you mentioned 2 items that you were going to focus on in your mission to rehabilitate youth. The first is retention of employees, and I think we may have addressed that with the 10% bump. And the second is the focus on reentry programs. Can you mention anything, an update about how your mission to put the youth back in our community and equip them for the skills necessary to be successful?
Yes, good question. And, that's one of the things we were really focused on this year. And, and part of the advantages with this pandemic, we actually gave us a little bit more time to take a little bit more deeper focus on reentry. And so we leveraged several partnerships during the year. One in particular that particularly comes to my mind is the Slutty Vegan and Pinky Cole Foundation partnership that we went to her, and our reentry team actually reached out to Pinky Cole and her foundation and asked for a partnership, because we know that the key to success and the key to keep these kids out of gangs and criminal activities is get them a job and keep them busy. And so with Pinky Cole and her foundation, what she's done, she set aside, and it's other companies out here too, but she set aside 30 jobs for youth, DJJ involved youth, to come work in her restaurants and her food trucks. Not only that, she's also provided $10,000 scholarships for these DJJ involved youth for continuing education, whether it's college, technical schools, or anything like that. As of last month, when I checked back with her, because we do a check-in periodically to see how those 15 kids are doing and see if we have any more in there, we had one of the kids that was featured on Fox News in Atlanta. He was there only 2 weeks, and his dream was to be a manager. And he gave a testimony on the news that, having this opportunity because of DJJ and Pinky Cole Foundation, having this opportunity kept him busy, it kept him off the streets, it kept him out of gang activity, and he had a dream to be a manager. Well, fast forward to December, he was now hired on to, I believe, full-time, and he was promoted to being over logistics for the whole operation. And so, just that alone is a huge success, and we're leveraging businesses and partnerships like that throughout the state. I've been around the state. I've been from, Metro Atlanta to Augusta to Savannah, and trying to create those partnerships. And so after that story and after that testimony from that youth, we've had several agencies, or I should say communities and community partners and businesses reach out to us wanting to do the same thing. And so that's one of the things that we're really trying to focus on here, especially this year, is making sure we give our youth an opportunity and a second chance to thrive.
Second question from Representative Chokas.
Thank you, Chairman. Commissioner, could you please tell me the status of the facility in Americus, Georgia?
And that's the one in Sumter?
Sumter County, yes,
Sumter
sir.
County? Okay, so as part of the last budget cuts, we've closed Sumter, the YDC at Sumter. And so that right now, that facility is offline. There's nobody in it. There's no youth in it. There's no staff in it. We are maintaining the upkeep of it. And so, of course, we're maintaining the utilities, keeping the grass cut, things of that nature over there, in case, in the event we need to bring it online, or it could be used in a different capacity.
Okay. May I have a follow-up question? Sure. Thank you. Well, you were talking about expanding facilities and in the bond package and so forth, and you're maintaining this facility to kind of keep up as backup. I'm somewhat confused.
So to expand, we're not really expanding our facility, we're actually shrinking our footprint at our YDCs. And so when you look at the Muskogee, if you've ever been to Muskogee, they're cottage style units. So each housing unit, for example, is separate. And so, and when it was built, it was designed pre-juvenile justice reform, and so it's kind of softer, so the kids can essentially, they can, while they're in their housing unit, they can walk out the door and just go onto the yard. And so with our population that we have now, we're spending a significant amount of money to also make sure that security measures are in place there, and then also maintenance, because it is an older facility. It wasn't built to house the youthful offenders that we have in our custody today. And so we're really not expanding our footprint. I want to say in Muskogee, let me get the actual bed capacity there. In Muskogee, we have 60 beds, 60 beds there right now. And so we're going to put a 56-bed housing unit at that location. The same thing with Augusta. Augusta, we have 100 beds there, and according to national best practices, you don't want, 50-bed facility is kind of where you want to be, and so we're constructing a 56-bed housing unit. So it's not a whole facility per se, it's just a housing unit and where the youth will, of course, sleep and lay their heads, not including any kind of recreational space, educational space, medical, anything like that. So we're not expanding our footprint. And one of the reasons why we maintain our facilities that we close is just so we keep our systems up in case SPC or anybody else has any future use for that property, and we be able to sell it. They don't have to waste money fixing the air unit or fixing or cutting grass or any kind of preventative maintenance. It'll be ready to go if the state so chooses to sell.
All right, Mr. Chairman, Commissioner, could we speak offline?
Yes, sir. Absolutely.
Thank you.
Chairman Watson, the question.
Mr. Chairman, just excited to see the 10% increase for your employees, but I know you said you were utilizing frozen positions and those funds. Those frozen positions, have they been vacant for a while, or how long have they been vacant? And I'm assuming you don't need those positions anymore going forward?
Well, I'm not going to say we're not going to need them going forward, but actually, I think looking at our current population right now, but of course it's kind of skewed due to Covert. Currently we have 914 youth in our care statewide. And so I think we're with the population that it's been over the last fiscal year and possibly before then, I think we can sustain freezing those 297 positions statewide on both. We make sure that we're not gonna put ourselves in any kind of position to where we're gonna be stretched too thin. But I believe if we have good quality applicants and good quality employees, we pay them enough, hopefully we'll be able to retain them and maintain that level of security inside our secure detention centers.
Okay, thank you.
You're welcome.
I think that's all the questions we had for you today. Commissioner Oliver, thank you again, and thank you for participating in the subcommittee hearings that'll be starting very soon.
Yes, sir. Thank you, and thank you all.
Thank you. We're running about 20 minutes ahead of schedule, so we'll take a quick break, allow for a restroom break, grab a bottle of water if you'd like to, and we'll pick back up right around 9:30, maybe a few minutes before.